Hello friends, in this video we are going to explore an app that I came across and found it very useful, especially when we are practicing dentistry and we have lot of patients. So this is an app that is especially for those who are practicing and who have lot of patients who come with an injury on their dentition. So this app is referred to as the Injured Tooth app. We will download this app. This app is available both on the Google Play Store as well as on the App Store. So let us download it quickly and show what we have to do, what are the features that we are getting in this app. So once we download it, we get this interface. Over here we have to provide all our details, so we will quickly fill up details: name, age, mobile number, country and email id along with the profession. So we'll quickly do these things and explore the app. So when we have downloaded the app, the first thing that we see over here is the injured tooth, and we can do the diagnosis and the management. And when we scroll down, it is an ultimate tool for management of the injury to the teeth and supporting structures. So basically the app will be useful in those type of cases. So we'll click on the next button and explore it further and see what's inside. So as we can see over here, that this is basically the guide for the user. Choose either the primary or the permanent tooth, then whether the injury is single or multiple tooth, images also in our cases, and the fracture line like subgingival or the crown root fractures. So all these things can be explored in this app. So basically it is containing the primary dentition injury, single tooth or the multiple tooth, the permanent dentition injury, or the combination, that is the 2 3 teeth or multiple teeth injuries involving the bone, alveolar bone, socket injuries, soft tissue injuries and other, and their management. So let us take an example. Suppose we have a single tooth injury in case of primary dentition, then we will click on it. We will enter the patient name, for example Nick, and the male patient, and then the age of the patient, suppose 3 years. We will take a simple case of a primary dentition, definitely. Then injured tooth, suppose in maxilla, incisor, soft tissue injury there is none, then chin injury no, then nerve tooth exposed no. So it will be, we will fill the details and we will get the diagnosis immediately that this is an uncomplicated crown fracture without soft tissue injury. So we'll click on the management, and after we click on it, we will see that there is a treatment that has been suggested to us, that we need to smoothen the edges, sharp edges. That is because the injury is involving only the enamel or enamel and dentine and is not involving the pulp. Now we can schedule the follow-up, that is 6 weeks, 3 weeks, 3 months. Now why we need to schedule a follow-up is because the injury is simple, but sometimes the pathology, if it might be there, then that representation in the radiograph will come after a week or so. So we will need to have a follow-up scheduled so that we can relate to any periapical changes that comes or represent at a later stage. So we will do the follow-up on, and during the follow-up visit definitely we are taking the radiographs, doing the clinical examination and examination of the soft tissues. So this is basically, we are getting it in a very simplified way, that when we are getting confused about any of the treatment modalities, especially related to the tooth injuries, because in the tooth injuries the diagnosis is very difficult and mostly can complicate the treatment outcomes if we not diagnose it in a correct way. Now apart from this, what this app can also do is that we have the classifications of different injuries according to NDS classification, so we can study about those classifications. And again, there are some IADT guidelines according to which we can choose which type of injury is there and how to manage those injuries. So the app is useful in all the cases. Like, also we can look for the terminologies, that what actually it means. For example, some colleagues is referring about the luxation injuries, so what they actually mean. So basically in our practice, very busy practice, or even in a normal routine practice, if an injured Yeah, patient comes with an injury on the tooth or related structures of the orofacial regions, then this app is very useful, and we can simply put on the details over there, and as you have seen earlier, and we can get the proper diagnosis based on the research and the guidelines that have been fabricated or are advised. So the app would save a lot of your time and give you a proper diagnosis so that you can plan an appropriate treatment and give the best treatment to your patients. So this was all about this app. Hope you find it useful and download it. Thanks for watching this video. Bye bye. Take care.